Hi, I'm Abdhanie Panontongan, and I will be discussing coronavirus disease 2019 or COVID-19, new normal in our future history. And here are the objectives of this lesson. At the end of this lesson, we will be able to know what is COVID-19 and its symptoms, what are the COVID variants, prevention and how it spread, who are the first 10 cases in the Philippines, what are the different types of COVID-19 vaccine, what are the COVID-19 new normal guidelines in the Philippines, what are the community quarantine and protocols or policies, and lastly, we have the Republic Act 11469 or also known as the Bayanihan to Heal as One Act. Severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2 causes COVID-19. SARS-CoV-2 is a new virus. The first cases were identified in people with pneumonia in Wuhan, China in late December 2019. The first case in the Philippines was identified on January 13, 2020. It probably started in animals but is now spreading between people. As this virus is new, we are learning more all the time, and what we know now may change. COVID-19 pandemic. The WHO or World Health Organization declared the situation a pandemic on 11 March 2020, signifying widespread human-to-human transmission in large number of affected countries. Although there is a lot we don't know yet about this new virus, we can still prevent the disease. Now, here are the variants of COVID-19. First is we have the B117 lineage or 501Y.V1 or VOC 2020-1201 or the UK variant. Second is B1351 lineage or 501Y.V2 or South African variant. Third is B1 lineage or 501Y.V3 or Brazilian variant. And the last one, we have the B1.427 and B1.429 lineages or the California or West Coast variants. Now here is the image of the mutation of SARS-CoV-2. This is as of February 8, 2021. Now as you can see, the concern is almost similar. Now we will move to how is COVID-19 spread. Most people are being infected from other people when in close contact within 2 meters or 6 feet. It spreads through droplets created when we talk, cough, sing, sneeze, or breathe heavily. These droplets enter the nose, eyes, or mouth, or when the infected droplets are inhaled. In indoor spaces with inadequate ventilation, COVID-19 has spread to people who are more than 2 meters or 6 feet away. Touching contaminated objects puts the droplets into your hands, and if you touch your face, the droplets can enter your nose, face, or mouth. Infected people with minimal or no symptoms can spread COVID-19. Now, we have the symptoms start like many other illness. Now, these are the common symptoms of COVID-19 include fever, cough, sore throat, fatigue, and shortness of breath. Symptoms start about 1 day after exposure but can be as long as 14 days. And most people develop symptoms within 5 to 6 days. It can also cause many other symptoms including headache or muscle aches, sudden loss of sense of smell and taste, runny or stuffy nose, nausea, vomiting or diarrhea, and we have the rush. Some people have those symptoms. Most have mild illness and it can be severe and sometimes fatal. Many patients recover fully in about 2 weeks, and in others, some symptoms like breathlessness, fatigue may continue for weeks and months. Now we have the diagnosis and treatment. Because symptoms are similar to many other illnesses, tests are needed to make the diagnosis. We have in the nose or throat swab and we have the blood test. There is no specific treatment. Several trials are underway. Mild symptoms can be treated at home with medicine to lower the fever or relieve the pain. And if symptoms are more severe, treatment in hospital is required. Avoid touching shared objects such as light switches, handrails, and door handles as much as possible. If you touch such objects, wash your hands and use sanitizer promptly afterwards and ensure you do not touch your face. Next, clean and disinfect frequently touch surface each day. More often, if you think they've been contaminated, use normal cleaning supplies. Next, do not share foods, drinks, and personal items including mobile phones. Next, or the last one is, do not travel if you are sick. More on use of mask. Follow local guidelines. First is, wear a mask when in face-to-face contact with others. Second, when social distancing cannot be achieved. Third, if you are in high-risk groups. And within a healthcare facility or other public spaces, when indoors, even if social distancing is adhered to. Wear a medical mask if you are sick, even if symptoms are mild. Second, if you have tested positive for COVID-19 or are waiting for test results. Third, when caring for a sick person. And if you are at high risk for severe COVID-19. Remember, masks alone don't protect. They should be used with other hygiene measures. Follow manufacturer's advice for use the mask, and the mask with exhalation valves should not be used. Prevention. Avoid potential exposure. First is stay at home as possible as practical. Second is maintain social or physical distance. Keep about 1 to 2 meters or 6 to 3 feet away from others, even if they appear well. Avoid crowded places. Keep face-to-face interactions brief. Maintain social distance when greeting visitors and avoid shaking hands, kissing, and hugging. And minimize gathering with friends and family. Now, work from home where possible. And as much or as far as possible, use private transport and avoid public transport. Keep away from people who are sick and don't let them cough or sneeze on you. And we have the last, avoid visiting hospitals and other medical facilities unless you need medical help or medical care. Now, are you ready for COVID-19? Prepare yourself and your family. Thing to do is monitor the situation and know your local health helpline numbers and be aware of the local procedures. Second, ensure you have access to essentials such as food, water, household supplies, and medicine. Third, speak to your doctor about any chronic medical condition you may have and get them under optimal control. Keep in best possible health. Get the recommended amount of sleep each day, eat a healthy diet, and keep up regular physical activity. Consider how you will manage if authorities impose restriction for a couple of weeks. Plan to be able to look after a sick household member and get the flu shot or the vaccine. This will reduce the risk of seasonal flu and possible confusion with COVID-19 symptoms. Now, what to do if you get sick? Stay home if you have mild symptoms. Do not go out to public places and monitor your condition. Second, minimize contact with people in the household until you have recovered. Monitor your condition and follow local guidelines for self-isolation. Third, cover your coughs and sneezes. Use a tissue or a mask if available and wash your hands with soap and water. Fourth, seek medical attention if your symptoms worsen and make an appointment. And lastly, wear a mask in case you need to visit a doctor and use private transport as possible. Now we are in when caring for a sick person at home. Limit the number of caregivers. That is first. And second is do not allow visitors and pets in the sick person's room. Third, have dedicated utensils, towels, and linen for the sick person. Fourth, wear a mask when caring for the sick household member. Fifth, make sure the sick person is resting well and is hydrated. And lastly, we have monitor symptoms and watch for warning signs. Now we are in screening and contact tracing. It is important to stop the spread of the virus. First, screening may be done at entry points to detect sick people, and you may be asked where you have been and your temperature may be taken. Second, health authorities may perform contact tracing, identifying people who have been contaminated with someone with COVID-19, and these contacts may be asked to stay at home for 14 days so they don't infect other people, and to monitor their health for 14 days in case they develop symptoms, and lastly, follow the advice of health authorities. Now, coping with stress during the COVID-19 outbreak. COVID-19 can be stressful. The effect can be both physical and emotional. First thing to do is you can reduce stress through listening, watching, reading about COVID-19 frequently, including social media, or to stop listening to them. Focus on the facts of COVID-19 and understand the risk to yourself and those you care about. third, separate facts from rumors, gather information from reliable sources. Fourth, find time to unwind and connect with friends and family. And lastly, if stress continues to hamper your daily activities, talk to a doctor or someone you can trust. Now, here are the first 10 positive infected with COVID-19. Our first case is, the first and the second is a couple, Chinese nationality. They visited from Wuhan, China. And we have the third cases, also a Chinese. The fourth case is Filipino, to case 6. Now the case 7 of the Philippines is Taiwanese. The case 8 is Filipino. The case 9 is American. And the case 10 is a Filipino male. Now, this is the status of COVID-19 vaccine within WHO EUL or PQ evaluation process. Now, these are the companies. First is the Pfizer or the BioNTech. Second is the Oxford or the AstraZeneca. Next is the Oxford AstraZeneca of Korea. Next is Serum Institute of India. Next is Sinopharm. Next, we have the Sinovac. We have the Moderna. We have the Johnson. We have the Gamaleya National Center. We have the CanSino Bio. We have the Vector Institute, Zhifei Longkong, Institute of Medical Biology of Chinese Academy of Medical Sciences, Sinopharm or Wuhan Institute of Biological Product, and we have the Novavax. Now, I will explain further about this COVID-19 vaccine. Now, how to different COVID-19 vaccine work? Now, there are four different type of COVID-19 vaccine. They are work in different field. First is we have the viral vector. Viral vector uses a harmless virus which is altered to contain part of COVID-19's genetic code. Now, we have the RNA or we have the nucleic acid. RNA contains a synthetic version of part of COVID-19's genetic code or the messenger RNA. Now, next is we have the whole virus. Whole virus contains a weakened or inactivated version of the COVID-19 virus. Now, we have the last one, we have the protein subunit. Protein subunit uses pieces of COVID-19 virus, sometimes fragment of spike protein. Now, here is the different picture. To explain more, we have here the virus-like particle. Virus-like particle, this type of vaccine contains molecules that mimic the virus but are not infectious and therefore not a danger. Virus-like particle has been an effective way creating vaccine against disease such as human papillomavirus, hepatitis, and malaria causes disease. Or we have here also the DNA, short for deoxyribonucleic acid or DNA, is another type of crucial micromolecules for life. A DNA vaccine involves the direct interaction into appropriate tissue of a plasmid, a double-stranded molecule which exists in bacterial cells. Now we will proceed to another slide. Here is the new normal guidelines of Philippines. Normal. After the onslaught of COVID-19, the paradigm of the new normal in the public health sector has emerged. At the core of it, the new normal is a way or a new way of thinking about deciding on and doing our usual affair with an invigorated sense to remain healthy by first, reducing vulnerability by keep a healthy lifestyle. Second, reducing virus transmission by observing infectious or infection control measure. Next is reducing contact with a potential disease carrier. Next, reducing the duration of the infect by establishing effective disease management mechanism. And ensuring governance and accountability by putting in place strong health regulation and policies. Now, new normals in our homes. Here are the plans to reduce the COVID-19's virus. Now, and we have also in the workplace. These are the new normal in home place, new normal in workplace, new normal in school. Now, these are the levels of community quarantine. First is the enhanced community quarantine. Next is the modified enhanced community quarantine. Next is general community quarantine. And lastly, we have the modified general community quarantine. Now, under enhanced community quarantine or ECQ, no movement regardless of age and health status. Second, minimal economic activity except for utility service such as food, power, water, and the critical economic sectors. Third, no transportation activity except for utility activities or services. Next is suspension of physical classes. Now we have in MECQ or Modified Enhanced Community Quarantine. First, limited movement within the contaminated or containment zone for obtaining essential services at work. Operation of selected manufacturing and processing plants up to maximum of 50% workforce. Limited transportation services for essential goods and services. And lastly, suspension of physical classes. Now we are in general community quarantine. First, limited movement to service and work within buffer zone or busy and outside buffer zone. Second, operation of government offices and industries up to maximum of 75% workforce. Fourth, limited transportation services to support government and private operations. Flexible learning arrangement operation at limited capacities to cater to students. Next, we have in modified general community quarantine or the MGCQ. Number one, or this is the only one, permissive socio-economic activities with minimal health standards. Now, ECQ is considered as the critical zone, while in ECQ is considered as containment zone or no movement at all. Now, GCQ is also known as buffer zone, and the MGCQ is outside buffer zone. Here are the policies for new normal. DOH Administrative Order 2020-0013 are also known as revised guidelines for the inclusion of COVID-19 in list of notifiable diseases for mandatory reporting to the to the DOH. Second, DOH Administrative Order 2020-0015, also known as Guidelines on the Risk-Based Public Health Standards for COVID-19 Mitigation. Third, OH Department Memorandum 2020-0157, also known as Guidelines on Cleaning and Disinfection in various settings as an infection prevention and control measure against COVID-19. Fourth is DOH Department Memorandum 2020-0178, or also known as Interim Guidelines on Healthcare Provider Networks during the COVID-19 pandemic. Next is DOH Department Memorandum 2020-0220, also known as Interim Guidelines on the Return to Work. Next is DOH Department Memorandum 2020-0246, also known as Interim Guidelines on Tobacco Control in light of the COVID-19 pandemic. Next is FDCP DOH DOLE Joint Administrative Order 2020-001, or also known as Health and Safety Protocols for the Conduct of the Film and Audiovisual Production Shoots and audiovisual activities during COVID-19 pandemic. Next is GAB or GOB PSC DOH Joint Administrative Order 2020-001, also known as Guidelines on the Conduct of Health-Enhancing Physical Activities and Sport during COVID-19 pandemic. Next is DOTR, DALG, DOH, and DPWH Joint Administrative Order 2020-001. It is also known as Guidelines on the Use and Promotion of Active Transport during and after the COVID-19 pandemic. Now, here is the Republic Act created for COVID-19. We have the Republic Act 11469, also known as the Biennial to Heal as One Act. An act declaring the existence of a national emergency arising from the coronavirus disease 2019 or COVID-19 situation and a national policy in connection therewith, and authorizing the President of the Republic of the Philippines for a limited period and subject to restrictions to exercise power necessary and proper to carry out the declared national policy and for the other purposes. Now, the following are some important things to know about biennial law and how it addresses the COVID-19 pandemic in the Philippine setting. First question is, what are the powers granted to the President under the biennial law? In general, the law allows the President to exercise the following power. Now, first, ensure the unregulated distribution and accessibility of essential goods and utilities such as power, fuel, energy, and water. Second, provide incentives and financial assistance to health workers. Third, regulate, direct, and compensate the private sector to cooperate with government when needed. Fourth, procure the necessary medical equipment and supplies. Fifth, engage or hire temporary health workers to complement the current health workforce. Sixth, realign the 2020 budget. Seventh, provide financial assistance to low-income households. And lastly, the other relevant powers, including the power to direct financial institutions and executive department to undertake cooperative measures to assess the general public. Now, number 2 question. What are the incentives for health workers? Among the incentives and assistance provided to health workers, both public and private, are the following. First, a special risk allowance. Second, hazard pay of 25% below to 5% of the monthly basic salary based on the salary grade of public health worker as provided for the Magna Carta of Public Health Workers or Republic Act number 7305. 3, PhilHealth coverage for all medical expenses if they are diagnosed to have COVID-19. Number 4, 100,000 compensation if they had contracted severe COVID-19 infection while in the line of duty, beginning retroactively from February 1 to 2020. Number 5, or the last, 1 million compensation if they die while fighting the COVID-19 pandemic, also retroactive on February 1, 2020. Now we are in question number 3. How will COVID-19 patients, persons under investigation or PUIs, and persons under monitoring or PUMs benefit from this law? The answer with that is, the Bayanihan Law assures that the cost of treatment for COVID-19 patients shall be covered by PhilHealth, and further, PUIs and PUMs are compulsory isolated and or treated as necessary. Now, number 4, how will the public, especially low-income families, benefit from this law? Now, the Bayanihan Law ensures protection of low-income household through an emergency subsidy of 5,000 to 8,000 per month for 2 months based on prevailing regional minimum wage rate, subject to the conditional cash transfer or CCT and rice subsidy. The law also intends to implement an expanded and enhanced Pantawid Pamilya Pilipino program or 4Ps, where either the Secretary of Social Welfare and Development or Labor and Employment shall transfer cash vouchers and goods through the local government's units or the LGUs, or directly to households who have no incomes or savings. The amount should be adequate to restore capacity to purchase basic necessity during the quarantine. For the duration of the quarantine, the public was allowed some breathing room by allowing the government agencies to move deadlines and timelines for the filing and submission of any documents, the payment of taxes, fees, and other charges required by law. It also directs banks, lending companies, financial institutions, including GSIS, SSS, and Pag-ibig to implement a 30-day grace period for the payment of all loans without penalties, interest, or other charges. And the 30 days grace period also applies to residential rent payment falling due with period of enhanced community quarantine. Now, the fifth question. How will the private sector and business owners can be affected by the passage of this law? All businesses will definitely be affected by the long enhanced community quarantine or ECQ. The Bayanihan Law authorized alternative working arrangement between the executive branch and the private sector to allow the fast and efficient action. For instance, the government may direct the operation of private hospitals and medical and health facilities to house health workers, serve as quarantine areas, medical relief and aid distribution location, or other temporary medical facilities. It will also regulate and limit the operation of the transportation sector and may direct public transport to ferry health, emergency, and frontline personnel and require business to accept contract for material and services. Aside from this, the law ensures the availability credit to the production sector of the economy. and shall be liberalized. The grant of incentives for the manufacture or import of critical and need equipment of or supplies. Now question number 6. How will the government budget be affected by this law? One of the major provisions of this law is the power given the President to realign the 2020 budget, which is essentially the amendment of the General Appropriation Act or GAA. Under the law, the President may discontinue programs and projects where a budget has already been allocated and use the funds therefore to address the COVID-19 pandemic. It also allows the President to use government savings, unutilize special purpose funds, unreleased subsidized cash, investment, and other government funds for the public health emergency. The law gives the President the power to reprogram, reallocate, and realign the budget and redistribute the funds to whatever he deems proper to address the pandemic. The law has also lifted the cap on the Quick Response Fund or QRF. Under the Philippine Disaster Risk Reduction Management Act, Republic or also known as Republic Act number 1012-1, the QRF has a limit of 30% of disaster management fund allocated to disaster risk reduction and management, whether national or local. The limit now being lifted, the national and local government may now use the budget as they deem fit and proper to implement the law. The law on emergency procurement applies for equipment and medical supplies required, as well as lease of properties for housing of health workers, quarantine centers, and medical relief and distribution locations. Now we are in question number 7. What are the tax implication of Bayanihan law? Importation of critical needed equipment or supplies to combat COVID-19 shall be exempt from import duties, taxes, and other fees. Now we are in number 8. How can we be assured that the President will not abuse the power granted to him by the Bayanihan law? As a checks and balance measure, the President shall submit its weekly report to the Joint Congressional Oversight Committee of all acts performed pursuant to the Bayanihan law during the immediate preceding week. This committee shall determine whether such acts, orders, rules, and regulations are with the restriction provided herein. The President must follow WHG or World Health Guidelines in implementing measures to prevent or suppress further transmission of COVID-19. Now we are in number 9. What are the punishable acts under the Bayanihan law and the penalties therefore? The Bayanihan law provides several acts punishable with imprisonment of 2 months or a fine of 10,000 to 1 million or both at the discretion of the court. 1. Disobedience by LGU officials of national government policies or directives imposing quarantine. 2. Unjust refusal to cooperate of owner and possessors of private-owned hospitals and facilities. 3. Hoarding, profiteering, injurious speculation, manipulation of prices, product deception and cartels, monopolies, or other combination of restraints of trades, or other pernicious practices affecting the supply, distribution, and movement of essential commodities. 4th, refusal to prioritize and accept contracts for materials and services necessary to address the COVID-19 pandemic. 5th, we have refusal to provide a 30 days grace period. 6th, spreading or perpetrating false information regarding COVID-19 crisis. on social media or another platform. 7 is failure to comply with reasonable limitation and operation of certain transportation sector. 8, and the last one, impeding access to roads, streets, and bridges, putting up prohibited encroachment or obstacles, and maintenance or of illegal construction in public places that have been ordered to be removed. And that would be all with my topic. At the last slides, there is the credits of this whole report. Thank you very much.